Black women in America are 3 times more likely to die from pregnancy-related complications than white women. This is according to the CDC. And that is prompting an urgent call for action during this Black Maternal Health Week. CBS 2's Jenna DeAngelis spoke to doctors working to make sure women get the proper care.
Hi, Papa.
On March 19th, Catherine Hurley welcomed her second son, Raphael, into the world.
Holding him and feeling like, okay, I'm safe, I'm good, he's good. It was just like the biggest relief ever.
The 38-year-old was considered high risk with an inherited blood clotting disorder, factor V Leiden. She developed a clot early in her pregnancy.
Luckily, I had a doctor who took my pain seriously. I don't know that, a lot of women of color are having the same experiences.
Finding a doctor that listened and self-advocacy were important for Hurley as a patient, especially knowing the startling statistics from the CDC. Black women are 3 times more likely to die from pregnancy-related cause than white women.
But it is something that in the back of your mind, you're so vulnerable because your life and your baby's life is in the hands of these experts, and you just have to assume that there's no bias in that room.
The healthcare and listening to patients and determining where this goes is really important to all of us, and that everybody gets equal care.
It's a focus at Mount Sinai West where Hurley delivered. The hospital system analyzes its own data to see where improvements need to be made.
We've been able to lower our C-section rate significantly and narrow that disparity.
Medical Director of Labor and Delivery, Dr. Desmond Sutton, says he's part of a committee which zeroes in on the impact of social determinants of health, the non-medical factors that influence health outcomes.
So like for preeclamptic patients, how is housing instability affecting those outcomes? For patients who have diabetes, how is food insecurity affecting those outcomes? Because the hope is that we can take this data and advocate for change in our community.
I definitely think just like talking about Black maternal health, talking about the experience is like the first step.
According to the CDC, more than 80% of pregnancy-related deaths are preventable, which is why raising awareness is so important. At Mount Sinai West, Jenna DeAngelis, CBS 2 News.